The TCAs, we don't generally use these a lot, and I'm gonna explain that a bit when we get to side effects. But when you talk about mechanism, the different TCAs will bind to different receptors, but generally the scope would be the different monoamine transporters, and then the all of them will have varying degrees of binding to the H1, alpha 1, M1 receptors, or in the so-called antipsychotics videos, we call those the ham receptors, and very important, the sodium channel, and that will I'll explain later on very easily their side effects. And well, when it comes to indications, you can kind of rationalize. For instance, clomipramine is the one with the most extensive overlap of indications with SSRIs, for instance, because clomipramine, among all of the TCAs we have in the Philippines, is the most potent, or even in general, the most potent SERT blocker among the TCAs. So you would expect it would have efficacy for anxiety and related disorders as well. For amitriptyline, so you would see some net blockade, so hence its efficacy for low doses. You can use it for migraine prophylaxis as well as other neuropathic pain syndromes like diabetic neuropathy, right? And well, PTSD, that's probably also how, say, paroxetine has efficacy. It also has some net blockade, no? But the other properties, similar, so similar onset of action. Sometimes you can divide the doses. Now we get to the main reason. The main reason we prefer SSRIs over TCAs, being SSRIs have a wider therapeutic index, which is very important in depression, right? Very important. One of the symptoms is suicidal ideation, that your drug has a wide therapeutic index. TCAs have a generally narrower therapeutic index because they are sodium channel blockers. You end up with potentially fatal arrhythmias there, and ECG changes, seizures, and all of that, because there are sodium channels not just in the heart but also in the brain. So yeah, that's not really a good property to have. I mean, they were instrumental in developing treatments for depression, but now that we have better, safer options like SSRIs, these are less preferred and generally not a concern for primary, secondary care talaga. Unless, use them in low doses for, like amitriptyline, in low doses for neuropathic pain conditions. Side effects, so because some of them block SERT, then you would expect, the usual sexual dysfunction, GI, etc. Then the ham receptors, so H1 antagonism, sedation, weight gain, alpha 1, orthostatic hypotension, M1, anticholinergic. Ayun, right? Just some other miscellaneous stuff you'll also see, but again, notably, be mindful of the sodium channel blockade. Interactions, mainly additive stuff, so additive ham, other drugs that block the ham receptors, then the CYP interactions, generally that's the gist of it. And of course, drug lab interactions with the false positives, so also be mindful of those. The CYP interactions, mainly 2D6. So 2D6 inhibitors can raise their concentrations, which would be problematic because, again, they are all sodium channel blockers. So be mindful of that. And again, the range of indications corresponds to their MOA, so more potent SERT blockade. That's more for clomipramine. You will see a wider range of the psych indications talaga. I've decided to just not talk about MAOIs anymore in this updated version because you can read up what installs. The main issue is the hypertensive crisis and the dietary restrictions with aged fermented foods and beans. But otherwise, we don't have them in the Philippines. So think of it as trivia. Just think of it as trivia. At least for the MAOIs used in depression. All of these you can just read up on your own, to save time. Because rather you master the ones we have here than spread yourselves out thinly on drugs we don't even have in the Philippines. It's not worth it. Some of these drugs that are not antidepressants may also be used in depression as adjuncts, mainly the second generation and third generation so-called antipsychotics, or the D2,5-HT receptor antagonists, or the partial D2 agonists as well, may also be used as add-ons, not as monotherapy, as add-ons usually.